Hi guys, my name is Tiffany and welcome back to another episode of Tiny Tips with Tiff, where I teach you skills in the NICU. Hopefully you guys are enjoying this series so far. Definitely give me a thumbs up if you are, and make sure to check out season 1 where I show you guys how to do some skills in the NICU, and hopefully you guys are enjoying the episodes I've been releasing for season 2. The first episode is all about healthcare team members and the types of people that you're going to be coming across on the unit, and the second episode is on how to give a report. So in this one I really want to focus on how to do a head-to-toe assessment. And every NICU nurse does their head-to-toe assessment a little bit differently, so this is just my way of doing it and how I like to do my head-to-toe assessment. So hopefully this video is helpful for you guys. Let me know down in the comments below what types of episodes you want me to do for this series, and hopefully this video is helpful for you, so stay tuned. Hi guys, so I'm just going to show you guys how I do my head-to-toe assessment. Of course, everyone does theirs a little bit differently, but this is just how I like to do it. And so I have my NICU baby with me right here, and then also some of the supplies you'll need. So the first thing that I like to do is whenever I go in, I always like to warm up my milk first, because this is what's going to be taking the longest. So while you're doing your assessment, having the milk warmed up and ready to go, as soon as you're done, you can just feed your patient right away. So that way you don't have to wait. So this is usually the first thing I do before I enter the room. And of course, make sure that you have all the supplies you need and that your stuff is fully stocked. So always make sure to grab the necessary supplies like I have here before I go into the room. So this is usually one of the first things I do first before I start my assessment. So while that's warming up, now I'm going to do my assessment on my baby. So the first thing I do while my baby is nice and calm is get a blood pressure. So I usually like to get a blood pressure first on my baby. It doesn't really matter what extremity, but typically the best one is always getting it on the right upper arm. So if you can, try to get a blood pressure on the arm first, and always make sure that when you get your blood pressure, there's always a little arrow on it. Make sure that goes on your artery. So on your brachial artery, you want that to line up with the artery on the baby. So this is what I do first, is grab a blood pressure. So while that is getting, and I want to make sure that my baby's nice and calm. So if my baby's moving around a little bit or getting a little bit fussy, you can always just grab a passy and you can give that to your baby, so that way your baby's nice and calm during your assessment. So while your baby is nice and calm, hopefully you were able to get a good blood pressure. If you are not, just keep the cuff on and you can always get it at the very end. So don't try to wait too long, or else your baby's going to get super agitated and you're not going to get appropriate blood pressure. So always make sure to get a blood pressure when your baby's nice and calm. So that's usually the first thing I do. So the next thing you're going to do is you're going to check your temperature. So I like to check the temperature, and of course you want to make sure to get an auxiliary temperature. So you're going to check under the armpit, and a normal temperature is 36.5 to 37.5. So if your baby is getting too warm and they're being bundled, make sure to unbundle them and check a temperature again in 30 minutes. So that's usually the next thing I do after I get my blood pressure, is I check my temperature. And then now we kind of go head to toe. So you want to look at your baby and see how they are. Sometimes we do measurements, and so you can also do measurements and do a head circumference. So in this case, if we're doing an admission, we're going to do a head circumference. And a head circumference, you don't have to do every assessment, but this is if we're doing an admission. You get your paper tape or whatever tape you use on your unit, and then we measure our head. So I'm going to move my little baby's headband, and with the head measurements, you want to do it right at the eyebrow. So my baby's head circumference would be 28. And then also, as part of your admissions assessment too, you can also do a length and a girth. So with the length, you want to do it at the crown of the head, and then you want to extend your baby's leg completely flat. So you may need to have a second person help you, and then you would measure right at the heel of the baby. So my baby would probably be around 36 is the measurement for my baby. And then also you would want to measure a girth too. So my baby's girth, and you want to measure right at the umbilicus. So I have a mannequin on, so make sure to measure at the belly. And my baby would probably be like 26 is the girth measurement. That's if you're doing an admission, but that is not what happens on a typical assessment that you do every 3 or 4 hours. So depending on your hospital policy, some may require you to do an assessment every 3 or every 4. but measurements are necessary. That's only if you're doing an admissions. So back to our head to toe. So with your head assessment, look at your baby and make sure to see on their head their fontanelles. So you're going to feel the top of their fontanelle and the bottom, the anterior and posterior fontanelles, and then make sure that it's flat and soft. So that's super important to note. If you're noticing any bulging or if it's full and your baby's nice, calm, and quiet, that is something you need to address to the team. But you want to make sure that when you feel the fontanelles, that it's nice and flat and soft. So you want to feel the top and the bottom as well of the baby. And then of course, looking at the baby's ears, making note of the symmetry of the baby's ears. So you want to make sure that it is symmetrical, and notice if there's any pits in the baby's ears. Sometimes they may have like little skin tags, pits on the sides of the ears, so make note of that. And then also make sure to assess the baby's eyes and whether it's wide or close together. So that's something to make note of as well. And then just make note of anything else on the baby's face. So look at the nose and make sure there's no boogers in there, and if you need to suction it, then of course suction it, and your mouth as well. So always make sure to do oral care for your baby. So what I like to do is I get some gauze, and you can also put some sterile water on there and just wipe the baby's mouth. And then of course my baby has an OG, so that's the next thing I'm going to assess with my head to toe, is looking at my baby's OG. So in report, you're going to get the measurement and the length of the baby. So my baby's OG is currently at 18, so I want to make sure it's in proper placement. So as a habit, with your first assessment at least, always measure it and make sure it's where it should be. So make sure to check out the video on how to insert an OG and how to do proper placement checking with that. But typically I will always measure it first and make sure it's in proper placement. And then another thing you can do also is I like to grab my OG and an oral syringe and pull back on it and see if I get any residual or not. So I like to check the residual of my baby. I know some hospitals aren't doing that anymore, so you want to really double check their policy, but really it's not going to hurt your baby for you to check it, and honestly I would just check it. So I always pull back and see if I get any air or any residual on my baby. And then also some hospitals do pH testing, so you can do that as an extra step too. So that's something that you could do. But yeah, I always make sure to check my residual for my baby. And another way you can do it too is Auscultate. So you'll get your stethoscope and your oral syringe, and then you'll just listen by putting, I usually like to put 2 mLs, and I would just push it quickly into my baby's stomach. So you put your stethoscope over the stomach and push fast, and you should hear air movement go through. And also make sure that when you're done to pull out the air that you put in, because you don't want to give the air to your baby. So that's usually what I would do when I'm checking for proper placement of my OG. So that's for the head, and then also making sure to check the symmetry of your baby's neck and look around and check if there's any folds or anything like that. And also, as a kind nurse, clean under your folds if you can by just getting some clean gauze and just like wiping under the baby's neck, because sometimes milk likes to spill under there, so you want to just clean your baby's neck. And then when you go down the line, we're going to look at our baby's chest, check if your baby's breathing comfortably, if there's any retractions, if your baby's working hard to breathe, and then also making sure what types of retractions they have. Is it subcostal, intercostal, and making sure if it's any mild retraction or moderate retraction or severe retraction. You want to look at your baby's chest. And then as I can see down the line, I'm going to take off my blood pressure. The next thing I'm going to do is take a listen for when I listen to my heart sounds and my lung sounds. So I'm going to listen with my stethoscope, and make sure when you're listening for your heart sounds, listen if you could hear a murmur or not. So it's very important to note in these babies whether or not you can hear a murmur. That's something you want to make note of. And then also make sure to listen for lung sounds too, and make sure that it's nice and clear bilaterally. And then also the next thing too, while you're already listening, is checking to listen for your bowel sounds too. So you want to see if you could hear bowel sounds or not. So that's very important to listen to that with your stethoscope. And then also, when you're assessing your baby, you want to check for pulses and perfusion. So check your capillary refill, check your perfusion, and make sure that your baby's color and tone is appropriate. And then also it's very important to check your pulses. So with a brachial pulse, you would want to check your brachial pulses and check on both sides too. I know my baby has an IV, so that can cover the other side, but also when you're checking your pulses, make sure to check them bilaterally. So if you're doing it on one side, you want to check on the other side. So if you're going to do your radial pulses, check on both sides to make sure that it's equal on both sides. You can check your fem pulses, you can check your popliteal pulses on your baby. So make sure to check your pulses with every assessment, especially if your baby has a PICC line. You want to assess the extremity of that PICC line. So if my baby's, for example, this baby has a PIV, but if my baby had a PICC line on this arm, I would want to check my capillary refill and my pulses on this arm. So make sure to check that, and you want it to make sure that your capillary refill is less than 3 seconds. So that's something that I would assess for my pulses and my overall wellness of my baby and perfusion, and making sure my baby is appropriate. So the next thing I would do down the line is, of course, checking and removing my pulse ox and making sure to place it in another extremity. So at my hospital, we change it every 6 hours, but some hospitals do it every 3 hours, every 4 hours, just depends. So make sure to take the pulse ox off your baby and assess the foot, and make sure that it's clean, dry, and intact, and there's no skin issues with your baby. And then I like to just place it on another extremity. So I'm just gonna put it on the other foot for my baby. So the pulse ox, you can put it on the hands, on the wrists, and you can also put it on the feet. So I like to do it on the feet just because it's easier, and make note of where you last placed it. So also you can do with your assessment checking for reflexes. So you can check your motor reflex and just doing a lot of range of motion with your baby. So you can move the extremities just to make sure that they're having some range of motion. So also you want to make sure if your baby does have access that you want to assess and make sure that it's patent. So I have some normal saline, syringe, and then also alcohol, and I'm just going to flush my IV line. So if you're not using it, make sure that it is clamped. But when you want to assess your flush, of course, make sure to unclamp it and uncap it. And then you always want to make sure to alcohol wipe your port with some alcohol. And we do it for 10 seconds and let it dry completely. And then you will flush your line. So of course, a lot of times these syringes will have some air in it, so make sure to push the air out and then flush your line. And really what you want to assess with your IV lines is check around the site. You want to feel around it and make sure it is nice and soft, and look at when your IV is being flushed, that it flushes through and that there's no infiltration. So you want to feel around it and make sure that it is appropriate and that it flushes well. So when you're done, of course, make sure to clamp it shut again and put a new cap on. So it's super important to assess your IV site, and if you have any sort of access, to always assess the site. So if you have a PICC line, do the same thing and assess your site and the dressing as well. So make sure that the dressing isn't lifted, feel around the dressing. If you have a PICC line, make sure to check the length out of your PICC, and it's very important to always assess your IV site for infiltration. So that's part of your assessment as well. And then also make sure that when you're doing a full skin assessment of your entire baby, to also turn the baby on the sides, and that way you can assess anything on the back of the baby, also on the back of the legs and the feet, because sometimes there can be pressure ulcers on the heels of baby's feet. So you really want to make sure to double check and assess your baby's skin condition and turn your baby when you're doing your assessment. And then sure, of course, if your baby is intubated or has respiratory support, make sure to suction your baby at the very end after you've repositioned your baby. So the next thing I would do is change my baby's diaper, and make sure when you change your baby's diaper to also assess their genitalia. If your baby is a girl or boy, always assess the inside of the baby. And then also feeling whether or not your baby has any hernias, because a lot of times some babies can have some inguinal hernias, which is where the intestine will go into the scrotum of the baby, or there's some babies that may also have other types of hernias, like umbilical hernias, where the intestines will kind of protrude through the umbilical cord. So you really want to feel and see if there's any hernias on your baby. So last thing you can do is, if you do need to, you can weigh your baby if you need to do weights or anything, and then you can just wrap your baby and make sure to reposition them. So it's very important to reposition your baby every 3 hours or every 4 hours, depending on how often you do your assessments, and making sure to put less pressure on the pressure points, so such as their heels and on the back of their heads. So making sure to put them in appropriate position and turning them as much as possible. So on their sides, or you can even put babies on their belly too. And a lot of babies like that. So it's really a quick way of how I do my head to toe assessment. Let me know in the comments below how you guys do your assessments, and I will see you guys in my next video. Bye. 'Cause anywhere you feels right, anywhere you feels like Paris in the dream, Paris in